Hi friends, welcome to Origyn Fertility and IVF. I am Dr. Rashmi Sharma. Today I am going to tell you about a very important advanced technology in IVF, which is PGT, Preimplantation Genetic Testing. Earlier we used to call it PGT or PGS, which is Preimplantation Genetic Diagnosis or Preimplantation Genetic Screening. It's an advanced technology in IVF and a lot of patients have a lot of questions about it. So I thought that with the help of this video, maybe people who are looking for this technology will have some answers. So I'm going to tell you about what PGT is, whether you really need it, in which patients PGT is advised, how it is done, what is the cost, and are there any benefits of doing PGT, and are there any harms of doing the PGT. But before that, if you wish to come to our center, you can see the number on the screen below. You can give a phone call and take an appointment. If you wish to consult online, you can see the link for online consultation in the description box below. You can take an online consultation as well. Now coming to the topic of the video today, which is Preimplantation Genetic Testing. What it is? As the name suggests, pre-implantation, meaning embryo before the implantation has happened. Genetic testing. That means we are trying to test an embryo before it implants and trying to test it genetically, whether it is a genetically normal embryo or whether it is genetically abnormal embryo. Okay, we are trying to ascertain whether it's a normal or an abnormal. Why do we want to do that? Because in IVF, so many times embryos may be abnormal. And we assume that maybe by testing the embryos prior to the embryo transfer, we might be able to increase the pregnancy success rate or live birth rates. How it is done? Of course, embryo is outside, that means it has to be IVF. Okay, in general, as we do IVF, we go ahead with IVF and we try to make day 5 embryos, that is blastocyst. In a blastocyst, there are, in the structure of the blastocyst, there is one inner cell mass which actually forms the baby later on, and there is an outer layer of the cell which is called as trophoectoderm, which in the later parts will form placenta. Right? So what we do in pre-implantation genetic testing, with the help of laser, we make a little hole in the embryo shell. Okay, it's very fine procedure. We put some holes in the embryo shell, and then we take out few cells of the trophoectoderm or do biopsy of the trophoectoderm cells and send these cells for genetic testing. And we assume that the cells of the trophoectoderm, which are going to form placenta, will be actually matching with the inner cell mass or the cells which are going to form the baby. Okay, and those cells are then sent for testing in the genetic lab. In the genetic lab, what are they going to test? Okay, that is very important thing, and that is how we decide that what type of PGT is done. Okay, so it's a little complicated subject, but I will try to make it easy for you. So what we are trying to test is the number of chromosomes. Okay, so in humans we have 46 chromosomes or 23 pairs of chromosomes. Every one of us have 23 pairs of chromosomes. Out of these pairs, 23 chromosomes are coming from your mother and 23 chromosomes are coming from your father. Okay, that's how 23 plus 23, 46 chromosomes are there in our body. You can understand it in a simpler manner, in a way that you can understand that maybe we have 46 books, right? So those number of books is the chromosome, and in those books there are thousands and hundreds of letters, and those letters are actual genes. So chromosomes are actually carrying genes, and those genes are deciding all the functions, and there could be so many defects in the genes which can lead to genetic defects. So based on this, PGT can be of 3 types. One is PGT-A, another is PGT-M, and the third is PGT-SR. What is PGT-A? PGT-A is pre-implantation genetic testing for aneuploidies. Aneuploidies means we are trying to detect number of chromosomes. So we are just generally testing whether this embryo has 46 chromosomes or not. So many times there will be embryos which have less number of chromosomes and which have extra chromosomes, trisomies and monosomies. Okay, so we are just detecting that yes, there are 46 books in this particular embryo or not. PGT-M, however, is trying to detect one single gene. Okay, so this is done in patients who have some genetic disorder in their family. Like recently we had a patient in whom both mother and father, both husband and wife had thalassemia gene, and they already had a baby with thalassemia major. Right, so we know we have to check for thalassemia gene in the resultant embryo. So we tested the embryos and then we found out that this embryo has thalassemia major, this embryo does not have thalassemia, and then transferred only the healthy embryo. So that is when we are testing only for one particular gene, and there are thousands of genes which can be detected, like muscular dystrophy, like breast cancer gene. So that is known as PGT-M. And the third one is PGT-SR or PGT for structural disorders. Now you would say, what is that? Okay, so many times it may happen that a person may have 46 chromosome, but one part of the chromosome got broken and inverted. So that is inversion. Sometimes one part of the chromosome has gone to the other part of the chromosome, right? So that is translocation. For that person, he may be absolutely normal because all the genes are there. But when that person will have a baby and only half the chromosomes are going, the baby is going to be abnormal. This kind of abnormalities are found so many times in patients who have had recurrent pregnancy losses. So that is PGT-SR, PGT-A, PGT-M, PGT-SR. In this video, I am going to talk only about PGT-A because otherwise the video would be too long, and in the subsequent videos, I would try to explain you about PGT-M and PGT-SR. Okay, so for PGT-M and PGT-SR, there are definite indications. We already know that somebody has a genetic disease or somebody has that structural abnormality. But what about PGT-A? So PGT-A, when it is recommended? So it is recommended when a lady's age is high, no more than 38 years or 40 years, because we know as the woman's age increases, chances of having an abnormal baby also increase. So in advanced age women, if somebody is going for IVF, sometimes it is recommended to go for PGT-A. The other patients may be where multiple IVFs have failed. I mean, you have gone ahead with so many IVF, the embryos are fantastic, the uterus is normal, still multiple IVFs have failed. Then we hope that by testing the embryos and by putting in a normal embryo, maybe we are likely to increase the success rate. Now, the third indication may be somebody having recurrent pregnancy losses or recurrent abortion. So by putting in a normal embryo, we hope that maybe we will be able to salvage the pregnancy and maybe we will be able to give this patient a live birth. So these are some indications. But does PGT really help, and is it indicated for all the patients? So no, it is not indicated for all the patients, and it has been shown not to increase the live birth rate. So in routine, PGT-A should not be done. So many times patients come to us and request for PGT, and then we have to explain them that by doing PGT, we are increasing the cost, but the live birth rates are not increasing. So PGT should be done only when it is indicated. Are there any side effects of PGT? So yes, there could be side effects. One is by doing PGT itself, because anyways you are making a hole in the embryo and you are trying to take out few cells, very rarely, but sometimes the embryo itself may be damaged due to PGT. This is one thing. The second thing, there are confusions in PGT. Like it's not 100% diagnostic test. There are false negative also and false positive also. Now you would ask why we are testing the cells, and how can it be that the result may be false positive or false negative? So yes, it can happen because of two things. One is mosaicism, other is autocorrection. Mosaicism, if you understand, is like mosaic tiles. So we understand that the embryo may not be having all the cells of same type. So many times embryos may be having some normal cells and some abnormal cells. And so many times the embryo may be able to autocorrect itself. So we have to remember that we are talking about very powerful cells. So just one from one cell, a whole human being is forming. These cells are very powerful. So many times, even if an embryo has some abnormal cells, it's able to autocorrect and lead to a normal birth. So many times it might happen that we take out a cell, but these were abnormal cells, but the rest of the embryo was normal. And we, kind of discarded that embryo. but that embryo had the potential of having a live birth. And so many cases have happened in United States, and they have been published, where a couple went for IVF in PGT, and they were informed that all the embryos are abnormal, but they were also informed that there is something called mosaicism and there is something called autocorrection, and so many times even an abnormal embryo can lead to a healthy birth. And the patient went ahead with transfer, and so many times healthy babies were born and reported. So this is one pitfall of doing PGT, that we are not 100% sure. So it should be done only when indicated, and it is not supposed to increase the live birth rate. So I hope this video would be useful for people who are looking for answers for PGT-A. If you have any more questions, you can write down in the comment section below, and we would be very happy to answer those questions. Thank you.